The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting the podcast, and thanks to everyone for listening in. Earlier this month, the Centers for Medicare and Medicaid Services released the 2026 Star Year ratings for Medicare Advantage and Part D plans. Each year, I sit down to assess how the MA industry is doing on quality. So this is our annual look at the state of quality in the industry. We'll take our normal 3 breaks, so let's tell you what happened to Star in MA for 2026. Last year at this time, the MA Star news for Star Year 25 was a 3rd drop in a row in Star performance from the peak in Star Year 2022. Here we are 1 year later, and the picture is mixed. The clear message coming out of the results for Star Year 26 is that the slide in quality appears to have been broken. But results are roughly stable overall. Results still are in the doldrums and remain at their lowest in many years for the most part. Very little progress upward has been made and can be seen for the industry overall. One key fact showing continued challenges for plans with stars: of the 481 MA contracts rated in both Star Year 25 and Star Year 26, about 29%, 140 of the contracts, saw ratings drop a half a star or more. 26%, 125 of the contracts, saw ratings increase a half a star or more, and about 45%, or 216 contracts, stayed the same. Where do we see some recovery in better or at least stable performance? Well, some measure performance is improving. Some cut points, average measure values, and average measure ratings seem to show plans doing better over the past few years coming out of the COVID pandemic. Contracts 4-star or greater are stable. In Star Year 25, about 40% of all rated contracts were 4-star or greater. For Star Year 26, about the same 40% are in contracts with 4-star or greater. Again, while that's stable, that percentage is lower than has been in the past. Enrollment in 4-star or greater is stable. In Star Year 25, about 62% of all MA enrollment was projected to be in contracts with 4 stars or more. That grew to 64% as of late. For Star Year 26, it appears about 64% of all MA enrollment will be in contracts with 4 stars or more. So again, it's stable, but it's far lower than it has been in the past. And average star rating is slightly higher. Both the contract average rating and enrollment weighted average rating has improved. The contract average rating went from 3.63 in 25 to 3.65 in 26. The enrollment weighted average rating went from 3.92 in 25 to 3.98 in 26. But the 25 enrollment weighted average had grown to about 3.96 anyway. In summary, while things stabilized or did a little better, we are still in an era of very low scores. The enrollment weighted average rating is below 4, and the number of contracts and enrollees in 4-star or greater plans remains low compared to the past. While we saw little rise in star overall, is it possible that the impact of disaster designation stopped some contracts from dropping more? And what might be the impact in Star Year 27 if disaster designations go down? We may take a stab at analyzing this in the future, but I wanted to call it out here today. With that, we will take our first break, and when we come back, we will tell you about big MA plan performance. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. We hope you're enjoying this edition of the Healthcare Labyrinth Podcast. Before the break, we gave you some of the important star results for 2026. Let's go a little deeper now with how the big MA plans performed. Big MA plan performance was a mixed bag. Some saw recovery, but not to the levels of prior years. Others still slipped more. Here are the 7 plans with the largest MA enrollment. United went up. United Healthcare 4-star plus enrollment went up from 71 to 78% in star year 26. Humana went down. Humana 4-star plus enrollment went down from a very poor 25% to an even worse 20%. Aetna also went down. Aetna 4-star plus enrollment went down from 89% to 81%, but that's still very high. Elevance went up. Elevance Health 4-star plus enrollment went up from 40% to 45%, but that's still a bit dismal. Kaiser remained at stellar levels. Kaiser pretty much maintained 100% of members in 4-star plus plans. Centene went up. Centene saw its 4-star plus enrollment go from about a miserable 1% to a still poor 19%. HCSC went down. HCSC, which bought the Cigna Medicare lives in 2025, saw its 4-star plus enrollment drop from 60% to 47%. The continuation of poor performance is driven by the inconsistent performance of big plans, which are about 3/4 of all enrollment. On the InsurTech side, Devoted and Alignment continued to do well. Clover Health, though, saw its largest contract dip below 4-star. That contract has 97% of its members. Let's now give you a feel for contract level performance. So this is going to be a comparison from star year 25 to star year 26 on how contracts in MA scored on the star scale from 2 up to 5 in half-step increments. 5-star ratings. In star year 2025, 7 contracts. In star year 2026, 18 contracts, a difference of plus 11. 4.5-star rating. In star year 2025, 86 contracts. In star year 2026, 73 contracts with a drop of 13 contracts. 4-star rating. In star year 25, 116 contracts. In star year 26, the same 116 number, so no change. 3.5-star rating, 165 contracts in star year 25, 175 in star year 26, so an increase of 10 contracts. 3-star rating. In star year 2025, 123 contracts. In star year 26, 111 contracts, or a drop of 12 contracts. 2.5-star rating. 23 contracts in star year 25, 21 contracts in star year 26, for a drop of 2 contracts. 2-star rating. Star year 25, there was 1 contract. In star year 26, there were 2 contracts with an increase of 1 contract. In total, in star year 2025, there were 521 rated contracts. In star year 26, due to contraction, there was 516 contracts for a difference of 5 contracts. Let's look at how high, medium, and low performance was between star year 25 and 2026. For the purpose of our performance assessment, we bundled high performers as 4.5 and 5 stars, medium performers as 3.5 and 4 stars, and low performance as 3 stars and below. The results. So low performers, again, anything at 3 or below. In star year 2022, the peak had 27 contracts or 5.8%. In star year 25, 147 contracts, or 28.2%. And in star year 26, 134 contracts, or 26%. Medium, which was 3.5 and 4 stars. In star year 2022, the peak, 268 contracts, or 57.9%. In star year 25, 281 contracts, or 53.9%. And in star year 26, 291 contracts, or 56.4%. And high performers, 4.5 and 5 star. In star year 22, 168 contracts, or 36.3%. In star year 25, 93 contracts, or 17.9%. And in star year 26, 91 contracts, or 17.6%. So what does this mean? Well, we found that the number of 4.5 and 5-star plans has dropped dramatically from 2022 to 2026, going from 168 to 91, a 46% reduction. For 3.5 and 4-star plans, the count has increased from 268 in 2022 to 291 in 26, a 9% increase. For 3-star and below plans, the count increased from 27 in 22 to 134 in 26, a 396% increase. As in the past, there was volatility among the high performers. From star year 25 to star year 26, there were 36 new contract entrants to the exclusive category of 4.5 and 5, which had 91 contracts, while 38 contracts dropped out. Of those in the club before, 7 went up and 5 went down. With that, we will take our second break, and when we come back, we will discuss a little more on average measure scores. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve star scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. Before the break, we gave you some of the important star results for 2026. Let's look at how measures performed in terms of average measure score changes. You can see my 1013 blog at the blog tab of healthcarelabyrinth.com for all the average measure results between star year 25 and star year 26. So what did we find? Well, star year 2026 had 45 MAPD measures, 33 Part C and 12 Part D. 3 measures were new and did not have ratings in star year 2025. In terms of Part C measures from 2025 to 2026, 13 measures increased, 6 stayed the same, and 11 dropped. Notable poorer or lower performing measures include breast cancer screening, care for older adults pain assessment, improving bladder control, plan all-cause readmissions, and follow-up ED. Notable better or higher performing results include colorectal cancer due to the guardrails, controlling blood pressure, medication post-discharge, statin therapy for cardiovascular disease, and call center. In terms of Part D measures, 6 measures increased, 2 stayed the same, and 4 dropped. Notable high-performing measures include call center, getting needed prescriptions, MPF accuracy, and statin use. Of note is that the 3 medication adherence measures declined or stayed the same and were low rated from 3.1 to 3.3. This is a problem area for plans, and these measures remain 3x weighted in star year 2027. Let's talk a little bit about challenges moving forward. For Star Year 2027, two new tough medication measures have come online: concurrent use of opioids and benzodiazepines, and polypharmacy, use of multiple ACH medications in older adults. The amount of time a member can have overlapping medications is very tight in these two measures. Due to data lags, many plans often do not know members have overlapping days until they are already non-compliant for the measure for the entire year. For Star Year 2027, the reward factor is being replaced with the Excellent Health Outcomes for All, known as EHO for All. Previously, it was called the Health Equity Index. It is slated to award just 0.1 of 0.4 total points in the first year to plans, down from the annual average of 0.3 of 0.4 for the reward factor. The formulas for EHO for All are complex, using a blend of 2 years of performance on low-income, dual, or disabled populations, enrollment growth impacts, and performance against all contracts. Star Year 26 saw the first true NCQA electronic measure in STARS, known as ECDS, come into play. That was colorectal cancer screening. I don't really count breast cancer screening. That happened in Star Year 25 as it was not a hybrid measure. More of these ECDS measures will roll out over time. Performance on colorectal was hugely challenging due to the conversion to ECDS. And in Star Year 27, the measure will change again by broadening the age band for colorectal cancer screening from 50 to 45. Star Year 26 also had improving or maintaining physical health and improving or maintaining mental health measures return, as well as a brand new measure, kidney health evaluation. The improving measures moved to 3 weight in Star Year 27. For Star Year 27, care for older adults functional status returns. The chart review option for diabetes care eye exam also goes away in Star Year 27. With that, we will take our last break, and when we come back, we will give you some closing thoughts. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back. Before the break, we gave you some of the important STAR results for 2026. Let's now go to some concluding thoughts and observations. STAR Year 2026 continues the theme that STAR achievement remains a huge challenge for plans, big and small. COVID allowances led many plans to be complacent in a key revenue and competitive advantage area. That continued until STAR Year 2025, and now to some degree in STAR Year 26. Plans lost focus, and many have not yet rebounded. What plans fail to appreciate, too, is the long tail of STAR. What do I mean by that? The 40-plus measures for MAPD plans are a curious concoction of clinical, drug, survey, and plan performance measures. Data used to calculate a given STAR year may be 1 year back for CAPS and 2 years back for HOS surveys, clinical measures, and plan performance metrics. Within the HEDIS clinical measures, the look back for compliance could add 1 or 2 more years. Once you get a STAR score, it does not impact your revenue until the next year. So, what you did a year ago and do today impacts your STAR score and revenue well into the future. What's more, plans have to be working multiple STAR years at once due to this lag. The point is that MA plans can never lose focus on the program, or they risk huge fallout well into the future. Many plans lack the technology, clean and timely data, and expertise to hone a consistent and high-performing program. They also lack the agility to respond to CMS changes in the STAR program. Technology to analyze and keep tabs on all the years in play, all the measures and formulas is key. The STAR year 2026 results signal continued tough financial times moving forward, complicated by risk adjustment reform and rate hikes that are not keeping up with utilization trends so far. Given ongoing poor performance on STAR for many plans, Congress could reassess the program. MedPAC, the congressional policy arm for Medicare, is especially keen on changing the program in many ways. The fact that just 40% of contracts and 64% of enrollment is in 4-star plus contracts will be especially concerning. But the problems can also be looked at as a positive and an opportunity. The STAR rating program is meant to be a continuous quality improvement program or process. We have such challenges on the cost and outcome front in healthcare that we cannot rest on our laurels in a given year and must continue to drive performance. In the end, that is what STAR is all about. So, in many ways, STAR is working even with scores dropping recently or being stagnant in STAR year 2026. STAR scores dropping can be seen as a sign that the STAR program is doing exactly what we want as a nation and what CMS's STAR mandate is for MA. Good quality care for members at a lower cost and increasingly better quality over time. So, while there will surely be more turmoil as a result of the STAR year 26 announcement, we should keep this in mind and celebrate a commitment to quality. Plans need to meet the challenge. With that, we will conclude this edition of the Healthcare Labyrinth Podcast. We'll see you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.